Pain in the shoulder, not able to raise it up, not able to do daily activities like reaching out to objects overhead, cannot do gym, or if you had some injury in the shoulder, since then your shoulder hurts, especially at night. All of these could be the sign of a rotator cuff tear. Namaste, my name is Dr. Prashant Meshram. I'm a shoulder specialist at Apollo Hospital, Jubilee Hills in Hyderabad, India. A lot of people come with pain which just would not subside, and typically they have some kind of injury with lifting weights, or they fall on that shoulder. And some older people, they come with the shoulder problem or shoulder pain even without any injury. They may be suffering from shoulder rotator cuff tear. It's a very common problem I see in my practice. Today we are going to talk about what exactly is this rotator cuff tear, what the signs or symptoms in which it gives you an indication that you may be suffering from rotator cuff tear, and what are the treatment options, which is extremely important so that we can take care of this problem. So what exactly is rotator cuff tear? A shoulder, there are multiple tendons or muscles which are surrounding the ball of the shoulder, which helps for the ball to move smoothly against the socket. These muscles stabilize your ball of the shoulder. They also ensure that there is strength when you're doing activities. So if because of an injury or because of age-related degeneration, if this muscle tendons called as rotator cuff tear, they cut from the bone attachment and they are just lying there in between the bones, and their function is lost, and typically patients present with pain as well as difficulty in moving their arm. A lot of these patients have injury in which they fall down by missing steps and they fall directly on the shoulder. Some of them, they also have an injury when they're lifting heavy objects. Typically patients come to us a few weeks or months after their injury or since the pain starts, and we as shoulder specialists do a thorough history and physical examination. So in history, we understand how your pain started, what all treatments you have taken, if you have any other comorbidities like diabetes, thyroid, any heart conditions which may be influencing your shoulder recovery. We also try to understand if you have been given any treatment in order to kind of plan. Then there is a physical examination in which we do a very thorough evaluation of how your shoulder movement is, how much the strength is, and this helps us to understand on which muscle tendons would be affected. Once we understand this, as well as do some special tests, we typically prescribe an X-ray or an MRI for the patient. Now, X-rays and MRI help us to see if there is any bone injury or if there is any injury to the rotator cuff tendons, how many of these 4 tendons which could be involved, and what is the grading or severity of this cut. A lot of times when people come with partial cut or a partial scratch, the treatment is completely different as compared to a full thickness, which means the tendon is completely ripped off from the bone. Doing an MRI is extremely important in order for us to plan our next step. Let's come to the treatment of rotator cuff tear. And the good news is that not all rotator cuff tears require operation. First, if people are having a scratch on the tendon, which is just a partial cuff tear, which is not going through the tendon, most of these can be managed only with physiotherapy. Some of them may require an injection as well, but these are the patients who are not prescribed or who are not advised the surgery right away. Unfortunately, if there is a full thickness tear, which means the tendon is completely ripped off from the bone, and if it is symptomatic, which means you have pain, you have weakness because of this problem, then you may require an operation. Now, there is good news in that as well. Even if it's a surgery, it is an arthroscopic or a minimally invasive operation. Let me explain that. So we do not make like a full cut on your shoulder. We don't have to cut open everything. We only make keyhole or very tiny, less than 1 centimeter incisions around your shoulder, which are typically 4 or 5 of these small keyholes. From this, we put advanced equipment such as a camera. Then we have a shaver machine as well as radio frequency. So these are the equipments which help us to identify as well as treat the rotator cuff tears without having to do an open surgery. Because it's a minimally invasive surgery, the recovery is expected to be a little faster and without much of blood loss. It typically takes me 1 to 1.5 hours to do this operation. The instruments as well as more importantly the suture anchors or the screws which we use to be anchored inside the bone, through which the threads come, and these threads, they go through the tendon, and when we tie them together, the tendon sits on the bone. The screws which we use, I like to use bioabsorbable screws, which typically means that these are the screws which will dissolve inside your bone after a period of about 1 year to 2 years, and you do not have any metal inside your body. After this surgery, typically the patient goes home next day. There is a resting period of about 1 month since we do the operation. This can vary depending on the kind of problem which you are having, but the resting period is very important so that the repaired tendons heal on the bone. After this healing is done, we start physiotherapy, which runs for about 2 to 3 months. In physiotherapy, the first challenge is to get your movement back, in which to ensure that there is no stiffness. And typically after 2 to or 2.5 months since the operation, we start strength training, which means whatever tendons are repaired, we'll make sure they start working again, they get their strength back. There is overall recovery period of 3 to 4 months in most of the patients with rotator cuff tear, after which they are able to do their daily activities, they are able to take care of themselves, they are able to make their hair again, they are able to wear clothes, they are able to go to washroom and clean themselves, and also they are able to drive, as well as most of them start playing sports if you like. So rotator cuff tears really are very common. They occur as a part of injury, or it can occur as a part of aging process. To repair them, the surgery may be required in a few cases, and some cases it may not be required, depending on your problem, which can be diagnosed by a shoulder specialist. And once this is done, there's a recovery period of a few months. After that, you get your shoulder back, as well as a part of your life and the quality of your life back. So if you are someone suffering from shoulder pain or a shoulder rotator cuff tear, then please do contact us on these numbers. We will try to get in touch with you and help you to the best way possible.